All right, class. So today we'll talk about environmental considerations, and as we go through the chapter, we'll note some important topics that you should know. I'm not going to go through every single slide. I'm just going to point out the major things that I want you guys to know. So the first thing we'll cover is hyperthermia. Here are some of the things to look out for. Elevated body temperature may cause death. Understand heat and humidity risk factors and recognize and manage symptoms of heat illness. Okay, so the next slide we talk about heat stress. So some major points to just note are it doesn't matter what condition you're practicing or playing in, you still have to, take caution and um, make sure that you're not overheating. Any type of heat stress is preventable, and as we'll see in future slides here, there's different ways to prevent that. And it says also, body will function only as long as temperature is maintained. Um, and one of the truest ways to, or one of the measurements to know is that your core body temperature should be around 99 degrees Fahrenheit. Any fluctuation uh, too far above that or too far below that will give you hyperthermia or hypothermia. All right, so the next slide we're going to start talking about the maintenance of body temperature. So there's going to be several points on how your body just naturally controls body temperature depending on the environment that you're in. So one of the ways is metabolic heat production. It says as increase in metabolic rate leads to increase in heat produced. And then it also depends on the intensity of physical activity. Here are some terms that you should be very familiar with. Make sure that you look these up in your book and that you understand um, how these relate to to environmental conditions and um, practicing or exercising in different temperatures. So radiation is exchange of heat with objects in the environment. So typically that will be done by sunlight. Conduction is when two objects are touching, and so you're getting direct transfer of heat by physically touching something else. Convection, an example that they give you here is the hot or cold whirlpool. So it says increases conduction if the air warm next to the body is moved. And then evaporation is what your body uses to try to cool the body down. It's done at the skin level and it helps cool the blood that's flowing through the blood vessels. Or a couple of the major points to understand here is that if you look down here at the last bullet point, humidity decreases evaporation. So at 65% humidity, um, evaporation is for the most part impaired, meaning the sweat on your skin is not going to evaporate at that percentage of humidity. Or I'm sorry, it's impaired. And then at 75%, so just by adding another 10% of humidity, um, evaporation is completely stopped. So knowing those 2 points is going to help the athletic trainers, the coaches, prepare their practices accordingly. Because if you're dealing with that type of humidity, you're not going to practice the same way as when you have minimal humidity and minimal heat. You're going to have to find some ways to take more breaks, take more water breaks, because you're going to know that your body's not going to be cooling down um, as fast or at the same rate as you would in lower humidity. Here's a diagram or an illustration of how the evaporation process happens at your skin. This is a good little figure just to kind of take a look at it and understand. And this diagram here, it just shows you, it's kind of like a graph. It shows you that based on activity level and then also air temperature, uh, what the water loss per hour is. So as you can see, as the temperature increases, regardless of activity, you're going to start losing more water per hour. And on this side of the graph, you see that as activity level goes up, the water loss per hour also goes up. So if you're on this end of the spectrum where temperature is high and activity is very high, that's when you're going to lose a lot of the most amount of water. So you kind of, this is a good diagram just to kind of um, help you decide how you plan out your practices, or what advice to give coaches based on how hard they want to practice, and then also the temperature outside. Since we're on the topic of humidity, here are the two instruments used to measure humidity um, for outdoor sports. The one on the left here, that works. That's the the I guess analog version of this digital psychrometer here. This is called the sling psychrometer. This is going to be your digital psychrometer. And so basically, they're going to tell you the relative humidity. So where you're at, it gives you a pretty specific percentage of what that is. So these are mainly used in really hot um, locations. So I would say like Florida, Alabama, places where the humidity can get up really fast. This is going to be part of the daily duties to measure that before practice, during practice, and just to have that information handy. The next topic we'll get into is exertional heat illnesses. So here we have three of them: heat rash, heat syncope, heat cramps. So make sure you read this in your book to get more detail on it. Heat rash is just basically, it's also called prickly heat. They're just raised red bumps. Heat syncope is fainting because of exercising in the heat. So it says peripheral vasodilation, hypotension, and because of blood pooling in the extremities. Heat cramps is excessive loss of water and electrolytes, specifically sodium. So heat cramps, occur because of profuse sweating. So you lose a lot of the electrolytes through sweating, and one of the ways to treat it is going to be icing. Another way is massage. But by the time that person is cramping up, it's usually pretty tough to treat them and then have them go back into play. So a lot of the times they're not going to go back into play, and the best way to treat it, or I guess to avoid this, is just prevention, and that can be done through a proper diet. So if you know you're going to go through a 2-a-day camp for the next few weeks, then one of the really easy strategy is just adding more salt to the athlete's diet, and that's why it says salt tablets question mark. That's because is that a viable option? Yeah, it is, but there's also an easier way. Just add more salt to your diet throughout the day, um, and that typically helps reduce the amount of heat cramps that your athletes are going to experience. But if it does happen, then ice, stretching, and then just rest is going to help that. In our next slide, we talk about exertional heat exhaustion. So it says dehydration causes decrease in cardiac output. So that basically means that the more the athlete is sweating, the less fluid they're going to have overall in their body. So the amount of blood running through the body, their total volume of blood is going to decrease, which in turn decreases cardiac output. It says mild hyperthermia with temperature below 140 degrees Fahrenheit. So when we're talking about those temperatures, we're talking about rectal temperature. So anything under 104 degrees Fahrenheit is going to still be considered heat exhaustion. So you'll notice athletes have pale, profuse sweating, cramps, dizziness, loss of coordination. And so the whole time that someone is experiencing this, you're going to keep track of their core temperature, heart rate, and blood pressure. So the treatment for exertional heat illness or heat exhaustion, I'm sorry, is to first remove the athlete from all activities. So immediately get them off the field, get them off the court, get them in a shaded area or air-conditioned area. You're going to want to start putting cold towels or spray them down with water, ice towels preferably. I would put them in where there's major arteries, so under the armpits, in the groin area, and then start pushing fluids immediately. So start giving them water, Gatorade, and that's, you're doing this as the athlete is still conscious. If the athlete is not responding well, if they're throwing up, if they're passing out, then this could very quickly turn into a medical emergency. So the next step would be, yeah, if they can't hold down any liquids, get them to the hospital so that they can start pushing fluids through an IV. Okay, so our next heat illness is heat stroke. This is a life-threatening emergency, and for the most part, between heat stroke and heat illness, in the early stages, there you may not be able to tell the difference. However, as either of these illnesses progress, for heat stroke, you're going to notice that there's going to be some abnormalities, altered consciousness, confusion, seizures, irrational behavior. You may see that the athlete gets really emotional, starts crying, gets really mad, just things that are out of the ordinary for this athlete. The other more objective measurement would be rectal temperature. This is where that temperature is going to be 104 degrees or higher. They're going to have hot skin, rapid and strong pulse, shallow and fast respiration. They're also going to have a decreased blood pressure. And one of the things that is, I guess, more exclusive to heat stroke is they may stop sweating. So you may find that the person that is suffering from heat stroke is going to have very red skin, but they're no longer going to be sweating. It's going to be they're going to be almost dry. Um, and it doesn't happen all the time for heat stroke. But it typically will only happen if they're having heat stroke. You won't see this really during heat exhaustion. So once you recognize that your athlete has or is experiencing heat stroke, you want to get their body temperature down as quickly as possible. So you want to have a cold whirlpool set up that's between 35 and 58 degrees Fahrenheit. And you want to submerge their whole body into it and then try to get their rectal temperature down to 101 degrees Fahrenheit at least. So once you have started to manage the athlete, you should have sent someone already to call 911 and have this athlete transported because they're probably going to need fluids pushed through an IV. And the other thing to be aware of is exertional rhabdomyolysis. And this is why it's a medical emergency because testing for that can't be done outside of a hospital. So you have to get them to a hospital as soon as possible. The next heat illness that we'll take a look at is exertional hyponatremia. This is a low concentration of sodium in the blood. It's typically caused by intaking too much fluid and not enough minerals and electrolytes. And this will throw the or yeah throw the balance of those of the fluid and the minerals in your blood, and it can cause similar symptoms as just having heat exhaustion. Either way, it can become a medical emergency very quickly, and the major vital signs should be taken consistently. And if the athlete is not responding to drinking water and drinking Gatorade and getting cooled down, then emergency transport needs to be called.